question is Mrs. Tamara. Mrs. Tamara here. Alright, you may please enter the room right now. Are you Mr. Tamara's husband?
Yes, I'm her husband.
Okay, you may enter the room with her.
Come in. Hey, take a seat. How are you guys? Let me introduce myself first. My name is Dr. Freya, and I will be the one who assists you. Please feel free to tell me about your concerns. I will do my best to help. As we speak right now, may I take some notes? Okay. And I will ask about some few questions. Is that alright? Okay. So please may I know your name, age, and address?
My name is Tamara and this is my husband, Ahmad. I am 27 years old and my husband turned 31 last December and we both live at Surabaya, number 101.
That's pretty far away from here. I'm sure the person here trust my community. And what can I help you with, Ms. Tamara?
So today I wanted to check my pregnancy, doctor. So this last week I experienced some bleeding through my womanhood and my due is still a long way.
Is there any problem before you bleed?
At first there was some slightly pink discharge and then this discharge became a bit more excessive and it kind of stirs me.
Yeah, I understand it's a difficult time. And can you please tell me what you're bleeding? Like what does it look like and how does it appear?
So at first the blood was brown in color and then some light spots started to appear and then after that the blood became excessive and it turned red in color like that.
And did you check the texture of the blood? Like, is it hard and thick or is it runny and loose?
It was thick and it was also hard to.
And you mentioned you had a great cramp before, right?
Yes, that's right.
And you were in pain for a week. So how did you manage to hold it in?
I took some medication which was ibuprofen, just like how I usually do whenever I get my menstruation cramps.
Oh, so it's like a regular menstruation. And how many times did you bleed in a day?
I think about it's like a regular period for me. So I think about 4 to 5 hours I had to change my pad. But then because it became more excessive, it took me about 3 hours.
And as for your cramps, is there anything that triggers your pain?
Not exactly, but I think just whenever I bleed, the cramps come like that.
On a scale from 1 to 10, how would you rate your pain?
About 8 out of 10.
Okay, alright. Did you notice any heart-related symptoms?
I think whenever I have pregnancy, I used to experience nausea, but then the nausea started to become less frequent and my breast started to become hard.
So your usual symptoms of pregnancy began to fade away?
Yes, that's right.
Alright, I think you told me enough about your pregnancy issues. I'm going to ask you about some general health. So is this your first pregnancy?
No, it was my second
Yes, this is her second pregnancy, doctor, and on her first pregnancy she had miscarriage.
My condolences for the both of you. So your wife had a miscarriage before. And when did this happen?
It happened about 3 years ago.
So you have operation procedures, right?
Yes, that's right.
If I may continue, do you have any allergy to specific drugs or foods and drinks?
No, she doesn't.
And do you currently take any medication at the moment? Other than ibuprofen? Like your previous doctor prescribed you with something?
Yes, my previous doctor prescribed me with some folic acid and some anti-miscarriage drugs before.
Okay, and I'm going to ask about some family history. So this is Mr. Ahmad. Do your family members have any notable disease or illness?
Not that I'm aware of.
And how about you, Miss Tamara?
I think the same. There's no one in my family that has any disease.
For the last question, it's a bit personal. How's work for the both of you?
For me, I think work has been pretty well.
It's so stressing, right? Okay. How about you, Mas Rahman?
There's no problem.
And do any of you smoke?
Yes, I did. However, after the last accident, I tried to quit.
And how many times did you smoke in a day?
8 times.
Times in a day.
I told him to quit, but he won't listen to me.
That's harsh. As for your alcohol drinking, did you any of you guys drink?
I do drink occasionally on some events and also on weekends.
And how many times do you drink in a day?
About a bottle and a half in my drink.
That's a bit excessive. And it's too much for your regular alcohol intake because it could reduce your sperm quality. And as well for your smoking habit, you better listen to your wife, sir. And last but not least, what do you guys think about what might be going on?
I think I'm just really scared about my baby, and I just feel like what happened yesterday will come back again.
And how are you, both of you helping I could do today?
Yes, me and my wife have always a child. After the last incident, after the cyclist, we got on the miscarriage of our first pregnancy. We were so down her, and right now we're so happy when we got happy news that she had pregnant again, and me and my wife are very worried now.
And finally, do any of you have any question for me? Okay, so we understand your concerns. Losing pregnancy might be a little harsh at any stage, and it's very heartbreaking, but it's perfectly fine because you feel devastated something, and I will do my best to help both of you, right, Miss Midwife?
Yes, I will be glad to help you with any concern. Do not hesitate to ask me to help.
Okay, and before we end this session, I will summarize what we talked about today. So, Ms. Tamara, you experienced leakage discharge that appears sometime before a week ago, and followed with brownish and reddish spots, and then it's looked like a regular period, but it's a bit excessive. And there's painful cramps along the way on the lower abdomen, and your pregnancy symptoms have begun to fade away. And during pregnancy, having miscarriage. And as for the husband, usually drinks alcohol and a former heavy smoker. Oh, and your return medication is folic acid and high-strength drugs and ibuprofen. That is all, right?
Yes, that's correct.
Okay, that sums up all of our interview today. Maybe we could go after some ultrasonography checks. Miss Midwife, could you help me?
Of course, doctor. Please follow me, Mr. Tamara. As for the husband, you can't stay here while waiting.